Having high serum cholesterol can affect any number of different organ systems in the body. Most notably, it can affect both the brain and the heart, and it's an increased risk factor for having a stroke or a heart attack. Cholesterol is transported throughout the body in a number of different ways, and the proteins that transport cholesterol have specific names. We like to think of LDL as a bad cholesterol in that it is delivering cholesterol that's made in the liver to the tissues, and that's a location where it can accumulate and cause blockages of different blood vessels. HDL we like to think of as a good form of cholesterol because it's bringing cholesterol essentially from our tissues back to the liver for storage. When we measure a cholesterol panel, we measure what one's total cholesterol is. We also measure triglycerides, which is a form of fat, and HDL. And from that, we will calculate what the LDL cholesterol is. In general, any level of LDL that's above 190 is considered too high. But that threshold for treatment may actually change based on whether or not you also have known coronary artery disease or have had a prior stroke, whether or not you have diabetes or other risk factors for having some of these events later on in life. The most common type of treatment for an elevated LDL is a statin medication. This is a medicine that reduces the synthesis of cholesterol in the liver. Statin medications in general are very safe medicines, but they do carry with them the potential for some side effects. The biggest risk for these medications is its potential for affecting the liver. That may not be something that a person actually can feel, and it's only detected on surveillance blood tests. Fortunately, the effect on the liver is relatively rare and generally not severe. One side effect that tends to be a little bit more common with these medications has to do with its ability to cause stiffness or pain in muscle groups of the body. That tends to be a bigger issue in the large muscle groups of the chest wall or the legs. There are some folks in whom statin medications can't be used, specifically folks with advanced liver disease or who are taking other essential medications that might interfere with statin metabolism. For individuals with really difficult to treat LDL, oftentimes we will escalate the dosage of statin medication up to the point where we start to find that there are either side effects or other complications related to that medication. At that point, we could consider adding an additional agent, and those agents can range from anything as simple as psyllium, which is the common component in many fiber over-the-counter preparations. Occasionally we may add another agent such as niacin or other pharmacologic agents that can work to affect cholesterol metabolism or cholesterol absorption in the bloodstream. Our thinking about treatment of elevated cholesterol has evolved over time. Now we appreciate that it's not so important to focus on a specific number to get to, so much as to incorporate lowering cholesterol within the framework of having a very healthy lifestyle. That involves eating healthy foods, getting plenty of exercise, losing weight when it's possible, avoiding smoking, all put together to help reduce one's risk of having a heart attack or stroke.